When it comes to drugs, India has a long history. From Vedic times, cannabis, also known as marijuana, has been used for various medical purposes and religious ceremonies. Cannabis is one of the 5 sacred plants mentioned in the Vedas. According to a website, in 330 BC, Alexander the Great introduced opium in India, and it was widely used for its medicinal properties. During the Mughal era, opium became a popular and widely used recreational drug in the country. But when the East India Company started ruling India, it took total control of opium cultivation and began trading it both legally and illegally. But nowadays, sale of prescription drugs and their ingredients, lifestyle and synthetic drugs are booming in India compared to heroin, brown sugar and cocaine. Now, the question is why the use of prescription, lifestyle and synthetic drugs is rapidly rising in the country. The answer is, first, most of these prescription, lifestyle and synthetic drugs can be easily sold and purchased compared to heroin, brown sugar, cocaine, etc. As buying and selling of these substances of abuse involve huge risks. Second, there have been reports of clandestine manufacturing and siphoning of synthetic drugs in India. As per the 2021 World Drug Report of the UN Office on Drugs and Crime, our country is the largest manufacturer of generic drugs in the world. In this video, we will try to give you an idea about some of the widely abused prescription, lifestyle and synthetic drugs available in India and their deadly effect on humans. Tramadol, fentanyl, methamphetamine, methadone, buprenorphine, Yabba and MDMA. All these drugs can be very addictive and kill someone if not taken without medical supervision. These drugs have become very popular in India, and the situation is getting worse day by day. Tramadol is used to help relieve moderate to severe pain. It is similar to opioid analgesics. The medicine works in the brain to change how your body feels and responds to pain, but this medication may sometimes cause addiction. Tramadol is usually prescribed as a slow-release drug that works over a period of time. But when crushed and inhaled or injected, it can produce powerful feelings of euphoria. Non-medical use of the drug leads to physical dependence and has been linked to seizures, psychosis, and even overdose deaths. Fentanyl is a prescription drug that has a high potential for addiction due to its euphoric and sedative effects. It's a powerful synthetic opioid that is prescribed to treat severe pain. Fentanyl can be more potent than morphine, making it incredibly dangerous when misused. Methamphetamine is a powerful and highly addictive chemical substance. It is used illegally as a stimulant and recreational drug. Methamphetamine directly affects our central nervous system. Street names for methamphetamine are meth, blue, ice, and crystal. Methadone is part of a category of drugs called opioids. Do you know, German doctors created it during the Second World War. Today, the drug is used for narcotic addiction treatment program. It blocks the high from drugs like codeine, heroin, morphine, and oxycodone. But taking it without medical supervision can lead to addiction or abuse. Buprenorphine is another opioid that produces euphoria or respiratory depression at low to moderate doses. It has a weaker effect than heroin. Buprenorphine and naloxone are used as a combination drug formulation to treat opioid addiction, but if misused, it can be dangerous for a human. Because of buprenorphine's weaker effect, it has become very popular among drug addicts in India. Yabba, the madness drug, is favorite in the dope circuit in the metro cities of India. Teens, or those who use Yabba, claim they experience a powerful burst of energy, heightened libido activity, and decreased appetite. Yabba is a combination of methamphetamine and caffeine. Both are highly addictive substances. Individuals who use Yabba face rapid heart rate, increased blood pressure, and damage to the small blood vessels in the brain. That can lead to stroke. Overdoses can cause elevated body temperature, convulsions, and death. Individuals who use Yabba may also have episodes of violent behavior, paranoia, anxiety, confusion, and insomnia. This drug is creeping into our country, mainly from Thailand, Laos, Cambodia, and Vietnam. From there, Yabba travels to Bangladesh and Myanmar, and after that, it enters India from the eastern and northeastern borders. 3. 4-methylnidioxymethamphetamine (MDMA) is a synthetic drug that alters mood and perception, awareness of surrounding objects and conditions. It is chemically similar to both stimulants and hallucinogens, producing feelings of increased energy, pleasure, emotional warmth, and distorted sensory and time perception. Other medicines like ephedrine, diazepam, Campos, Valium, Brufen, Alprazolam, Xanax, and Phenergal, ketamine, and lignocaine injections can be very addictive if taken without medical supervision. However, a sizable part of the illegal drugs trade in India relates not only prescription drugs but also their ingredients and chemicals that serve as raw materials for synthesizing or cooking drugs.